we're going to talk about is we're going to look at the impact of Lyme as reported to the CDC for Ohio in 2013 and Pennsylvania 2013. Okay? So these are numbers actually reported to the CDC in 2013, and we have 93 reported cases of Lyme in Ohio, and we have 1,758. Who's got their calculator ready? For a long time in Ohio, if you thought or suspected that you had Lyme disease, you would go to your doctor and you'd say, I think I have Lyme disease, and you wouldn't even entertain the possibility of testing for it. So he'd say, no, we don't have Lyme in Ohio. You wouldn't get a test, the test being not likely to yield a positive result anyway, but absolutely zero chance of an acute diagnosis. Zero chance of an acute diagnosis in Ohio, and yet we still managed to have at least 93 reported cases in 2013 and 58 in Pennsylvania. So I live about an hour away from Pennsylvania. Which number do you think concerns me most? What do you think I suspect my family's exposure to Lyme disease might be? Unless there's a great big wall between Ohio and Pennsylvania I'm not aware of that no bird can possibly fly over. And I'm a little bit more concerned about this number than I am this number. I think we have a reporting issue. So before we even came to Washington, this was our idea of what we thought the numbers were, but as we're on our way, the Ohio State Medical Association releases a press release to its physicians and says, Lyme disease and other tick-borne illnesses are invading Ohio. Physicians should play a major role in educating the public and other clinicians on how to treat or even prevent tick-borne diseases. So we're having the conversation now. And we're less likely to go to our doctor and say, we think we have Lyme disease, and we're thinking we're less likely to be turned down that that's a possibility. They're at least going to entertain the conversation. We also have some information from Professor Needham, who is retired from the Ohio State University, who is regarded as Ohio's tick expert, who has been performing field studies on the prevalence of ticks in Ohio and what types of diseases they're carrying. And what we have here is a report that he has authored and published, which contradicts information from the CDC, which is really important. What we need to understand is that the CDC is this large, slow-moving entity that has antiquated data that we can't rely on, even though our doctors are going back to them for what is our direction. CDC says that Ohio is not endemic for Lyme. This report that is conducted on the ground by Professor Needham in Ohio suggests otherwise. So now we're going to go to 2013 press release from the CDC. Prior to 2013, the CDC said, we think there are 30,000 cases of Lyme disease annually in the entire nation. In 2013, they said, we left off a zero. We think it's more like 300,000 nationwide. So now we can all agree on a multiplier of 10 for those reported numbers to the CDC, and that is from the CDC. They say multiply it times 10. So now we've got 9,300, 930 cases in Ohio potentially, and we have 57,580 in Pennsylvania.
And that's going to grow exponentially.
Yeah. So that is the CDC saying we think that it's more likely that there are this many cases happening in 1 year in addition to what's reported. So now we want to talk about, you have my calculator ready? Yes. What is the financial impact of this on our economy in Ohio? Our average SSDI benefit is $1,165, and that's monthly. Annually, $13,980. Want to multiply that times 930? And we're going to get into in just a second why we think that